A lot of people out there in the state who are very excited that the Medicaid expansion has passed. Under the plan, nearly 500,000 people in the state would be eligible for insurance. Anthony Sabella tonight has more.
At 40 years old, Nick Reeser of Lansing owns a small cleaning company and works an extra part-time job to keep himself afloat, but it's come at the expense of his health.
I've had a lot of problems with getting coverage. I've been self-employed for the better part of 10 years. And the medical plans are just extremely expensive.
Currently on a temporary county health plan, Reeser makes too much money to qualify for Medicaid. But with Tuesday's Senate vote to expand the federal health care program, Reeser and other patients at Carefree Medical are one step closer to not having to worry about coverage.
This is really important to the residents of Michigan, and especially in Ingham County, because we have a high percentage of very low income but working individuals.
That's exactly who will benefit.
Of the adults that are on the current Medicaid program, it's up to 35% of the federal poverty level.
But under the expansion, those who make up to 133% of the poverty level could be covered by Medicaid. That equals about $15,000 a year. And for a family of 4, it equals about $30,000 a year. First, the legislation has to pass through the House because of amendments added after the original vote. The Michigan Department of Community Health, which is in charge of monitoring the changes, expects that to happen. Angela Minicucci says it will help the entire state.
When people don't have health insurance, they go to the emergency room and they receive care, but they can't pay for it. So that gets shifted onto businesses and taxpayers in Michigan.
The expansion should increase prevention, helping people like Nick Reeser.
I'm sure I'm not the only one that waited to the worst last second and found the last dollar to make it happen.
In Lansing, Anthony Sabella, Fox 47 News.
The Department of Community Health is hoping to have legislation pass in the House next week. If that happens, it can then be signed by Governor Snyder.